Hi, I'm Dr. Rebecca Reese. I'm a physician and infectious disease expert in West Virginia. Throughout the pandemic, I have cared for many patients with COVID-19 and have led research on COVID-19. We are hearing a lot about COVID-19 variants, and naturally there are questions about what they are and if the vaccines are effective at protecting against them. Viruses constantly change through mutation, creating new variants or strains over time. Sometimes new variants emerge and disappear. Other times new variants emerge and stay. Multiple variants of the virus that causes COVID-19 have been found in the United States and around the world during this pandemic. These variants are slightly different from the past strains, and they can even infect people who had COVID-19 before. Scientists continue to study these variants. For example, they are looking to see how easily they spread, the severity of the disease they cause, and how well the vaccines work against them. Ongoing studies have found that the COVID-19 vaccines can help prevent severe disease, hospitalization, and death from the variants. Areas with low vaccination rates are more vulnerable to the virus transforming, potentially becoming more contagious and severe. Large portions of our communities getting vaccinated helps create a firewall against the virus, preventing the virus from spreading and changing. The faster we get vaccinated, the faster we can build a community of immunity against the virus and its variants. Protecting our community from variants is one of the reasons that I chose to get the COVID-19 vaccine and why I recommend it to others. Thanks for tuning in. I'm Dr. Rebecca Reese. For more information about COVID-19 vaccines or to find a location near you, visit Vaccinate.wv.gov.
Hello, everyone. It's Friday, September the 24th. There's no way of sugarcoating this. We've lost another 56 people since Wednesday. I ask you again to join in prayer for them and all their loved ones, and please, just don't let them become a number. Our 3,468th death is a 97-year-old male from Harrison County. Our 3,469th death is a 69-year-old male from Greenbrier County. Our 3,470th death is a 70-year-old female from Wood County. Our 3,471st death, a 92-year-old female from Taylor County. Our 3,472nd death, a 57-year-old male from McDowell County. Our 3,473rd death, a 68-year-old male from Cabell County. Our 3,474th death is a 53-year-old male from Nicholas County. Our 3,475th death, a 59-year-old male from Marshall County. Our 3,476th death, a 65-year-old female from McDowell County. Our 3,477th death, a 75-year-old female from Mason County. Our 3,478th death, an 89-year-old male from Morgan County. Our 3,479th death, a 62-year-old male from Wayne County. Our 3,480th death, a 67-year-old male from Cabell County. Our 3,481st death, a 74-year-old female from Harrison County. Our 3,482nd death, a 59-year-old male from Jefferson County. Our 3,483rd death, a 79-year-old male from Lincoln County. Our 3,484th death, a 57-year-old male from Marshall County. Our 3,485th death, a 96-year-old female from Monongahelia County. Our 3,486th death, a 53-year-old male from Pleasants County. Our 3,487th death, a 59-year-old male from Taylor County. Our 3,488th death, a 77-year-old male from Marshall County. Our 3,489th death, a 63-year-old female from Worth County. The 3,490th death in West Virginia is a 64-year-old female from Mason County. The 3,491st death is an 86-year-old female from Braxton County. The 3,492nd death is a 90-year-old male from Cabell County. The 3,493rd death is a 44-year-old female from Upshur County. The 3,494th death is a 67-year-old male from Worth County. The 3,495th death is a 90-year-old male from Preston County. The 3,496th death, a 90-year-old male from Greenbrier County. the 3,497th death of 64-year-old male from Lewis County, the 3,498th death of an 80-year-old male from McDowell County, the 3,499th death is a 79-year-old female from Braxton County, the 3,500th death in West Virginia is a 69-year-old male from Tyler County, the 3,500th and first death is an 80-year-old female from Taylor County. The 3,502nd death is a 78-year-old male from Mercer County. The 3,503rd death is a 95-year-old male from Cabell County. The 3,504th death is a 59-year-old male from Mercer County. The 3,505th death, a 40-year-old female from Ritchie County. The 3,506th death, a 51-year-old male from Hampshire County. The 3,507th death, a 67-year-old female from Mercer County. The 3,508th death, a 56-year-old male from Hampshire County. The 3,509th death, an 82-year-old female from McDowell County. The 3,510th death, a 71-year-old female from Berkeley County. The 3,511th death, a 51-year-old male from Hampshire County. The 3,512th death, a 57-year-old male from Taylor County. The 3,513th death, a 68-year-old female from Putnam County. The 3,514th death, a 54-year-old female from Mingo County. The 3,515th death is a 55-year-old male from Mercer County. The 3,516th death, a 74-year-old female from Upshur County. The 3,517th death, an 83-year-old female from Mercer County. The 3,518th death, a 93-year-old female from Raleigh County. The 3,519th death, a 62-year-old female from Mineral County. The 3,520th death, a 54-year-old female from Marshall County. The 3,521st death, a 58-year-old male from Logan County. The 3,522nd death in West Virginia is a 28-year-old male from Logan County. And the last one today, the 3,523rd death, a 71-year-old male from Logan County. A little over 16,000 active cases. We're up a few cases since the last meeting on Wednesday. The positive cases that we've had in the since the last update are 2,685. A daily percent positivity rate of 10.78. The cumulative rate is approaching 6%, as at 5.78. Recovered cases are 211,000 and a few. Now we have 1,008 people that are hospitalized, 289 in the ICU units, 187 on ventilators, which is an all-time high. A bunch of these people are going to die. We could have stopped this. We have two green counties. That's Tucker, who has an incredible vaccination rate, from what I understand, and Pocahontas. There are 90 school outbreaks in 31 counties and 880 confirmed cases. Confirmed cases. A lot of kids are walking around with COVID and don't even know it, but we know of 880 that are confirmed. We have one county that doesn't have a mask mandate, that's Pocahontas. We are slipping a little bit in the number of people that are hospitalized, that are unvaccinated, have dropped from 86 to 80. That means 20% of the people that are in the hospitals are fully vaccinated. Now, what does that really tell us? That tells us that there's a growing need more and more and more for people that are fully vaccinated to get their booster shot. We have said it, and we have been out on the forefront of that, and I'll talk to you a little bit more about that in just a second. From the standpoint of if you're 65 and older, any symptom whatsoever, please get tested. The antibodies are waiting on you. And again, from the standpoint of wearing face coverings and so on like that, if you're in a big crowd of people indoors and you have any compromising, situation about yourself and everything, you really should be wearing a mask. I mentioned to you just a second ago about boosters, and I don't get it. I just don't get this. Our federal government moves like a turtle, and a lot of times it moves like a turtle in the wrong direction. But finally now CDC has authorized, and they have basically overridden people to authorize boosters for people with all kinds of situations. For the most part, if you want a booster shot and you're 12 and older, or rather 18 and older, in any situation just about that you feel compromised, you can now go get your booster shot. We're giving them, and we're giving them all across our state. I'm going to go really slow because this is terribly important to a lot of people. I'm going to read to you just a little bit of stuff here, but it is terribly important and very, very, very critical that if you are especially outside that window, you really need to go get a booster shot. I told you about my meeting with the Johns Hopkins doc and everything, the guy that's the head of all this with Johns Hopkins, and absolutely he highly recommends you get a booster shot. Now, I'm going to read with you just a second here. Today, the CDC authorized booster shots for the Pfizer COVID-19 vaccine for certain populations, and also recommended a booster shot for those in high-risk occupational and institutional settings. The CDC recommends, and listen closely to this, people 65 and older and residents in long-term care settings should. Now I'm going to read different words to you, but I'm going to say either should or may receive a vaccine. Now I'm saying 65 and older residents in long-term care facilities should receive a booster shot if you're 6 months out from your last dose of Pfizer. People that are 50 to 64 years of age with underlying medical conditions should receive a booster shot. People that are 18 to 49 years of age may receive a booster shot. And people that are 18 to 64 years of age who are at increased risk, in any situation of being exposed or being able to transmit may receive a booster shot. So basically what it's saying is this: if you're 50 and older, you ought to get a booster shot for sure. And if you're 18 to 6, I'm sorry. I don't know. If you're 18 to 49 years of age and you are in any situation to where you are compromised health-wise in any way, you may get a shot. But in addition to that, if you're 18 to 64 years of age and you're in a situation to where, you could be exposed, you could be transmitting, you may receive the shot. So basically they're opening the floodgates completely now, and they're dancing around it with some gobbledygook language, but they're opening the floodgates wholeheartedly and everything to say, go get the booster shots. You need to get the booster shots. It'll absolutely help you in every way. And the only other thing that I'd like to read to you is just this. It says, getting your shot, take your vaccine card and go anywhere giving out vaccines, and you can get your booster shot right there. If you've lost your card, you can request a new one from DHHR, and you can call the vaccine hotline if you have any questions naturally. Now, stay with me just a second. We've got all the Pfizer extra that we need, and all of this centers around Pfizer. It's about Pfizer and Pfizer and Pfizer. The CDC will also evaluate recommendations for people who got the Moderna or the Johnson & Johnson vaccines in the very, very, very near future. But this is all about people, irregardless of age just about, all about people that got the Pfizer vaccine. And we're ready to go, and we're ready to go with the Pfizer, and absolutely we'll let you know on Moderna and Johnson & Johnson as soon as the CDC gives us the go ahead to do so. Just another little more update. We're at the nursing homes giving out shots right now. Again, I said it over and over. We pleaded with the CDC. We pleaded with the Biden administration over and over for days and weeks, saying we've got to be giving these boosters. We got to be giving these boosters. We had a committee or whatever even vote and say, no, we don't think that's a good idea and everything. Well, thank goodness somebody is finally coming to their senses and saying this has to be done, because literally our hospitals are really challenged right now. And if what is happening is the unvaccinated percentage is increasing, all that tells us is we've got to get booster shots. We have to get booster shots, and we've got to get them right now. We gave out 3,700 doses since the last meeting. I can sit here and say, well, that's great. We got 3,700 doses. That's probably some lives that we've really saved without any question. We got 3,700 doses, but with our numbers adjusted the way that they were, we got a lot of people that are out there that haven't been vaccinated, and 3,700 is just not enough. That's just all there is to it. In the Do It for Baby Dog Round 2, the sweepstakes, we went out, we were all over the state. I mean, for crying out loud, we were here in Charleston, and at a couple locations here in Charleston. We were at John Adams Middle School and at Polka High School, and then we went from there to Parkersburg, and then we were able to give a boat away to a gentleman that was one of our transit bus drivers there, and doing great work there in Parkersburg, a great man. And then we went on from there to West Liberty University, and I really enjoyed that and everything. West Liberty is an incredible school. And so we really just made it all across our state yesterday, and that was some good stuff. And then we went back and had a meeting with the folks at the Raleigh County Airport about some issues that are going on there. And so big day, a lot of travel. All the beginning leg was driving, and so we put a lot of miles on a vehicle yesterday, and a little bit of flying back to the meeting at the Raleigh County Airport, but a big day. The biggest and most profound part of the day to me is really not giving away the car or the boat and everything, even though that was great and everything, and all the different things that people can win in the participation. I've said it over and over that the good Lord gave us the ability to smile and to laugh, and we really, as tough as things are right now, a little bit of laughter and a little bit of smiles are really good stuff, and maybe good medicine for all of us. But the best of the best was just this. We presented a 4-year scholarship at John Adams Middle School to Maggie Hill. And right there she is with my little buddy with me and everything. And then we went on from there and gave a full 4-year scholarship to a guy, a great athlete, Chaz Grady. And Chaz, his grandma walked up to me when it was over and said, you can't imagine that either one or both of Chaz's parents passed away at an early age, and they have issues, and they've worked really hard, and you can't imagine how much and how good this will be for that young man. So Great stuff there. And then we went, I mean, I don't know how it gets any better than this. I really don't. And then we went on from there and gave out some other stuff and went to Parkersburg and gave a wonderful boat to a great man that's working hard for us every day and doing great work for the city, you know, in the Parkersburg area, and that's really great. And then we went and a young lady on the soccer team at West Liberty, and I thank Dr. Evans and all those people at West Liberty. It was a great day. I mean, it was a really good day, you know, and this young lady won an incredible car, but all these people and them getting themselves vaccinated, that's the real bottom line. I had the opportunity to be in front of lots of young people yesterday and pushing and urging them to get across the finish line. It just gives us a real chance and a voice to get out and talk to them, so it's really good. On our vaccine eligibility, of course, it's 12 and older. I need our parents, grandparents, and everybody to help us with getting the kids vaccinated. That's really important. Our grand families have got 19,000 kids there that they're looking after and everything, and if they can get them across the finish line, that really helps us. I just say just this, the alternatives are real simple. We're doing marketing campaigns with TV ads. We're traveling all across the state with Baby Dog and doing stuff there. We're absolutely urging people from the broadcasters. They've stepped up and said over and over they've helped us, in trying to get people vaccinated. The work at WVU, unbelievable. There's so much going on. There's so many testimonials from people that are out there that have had this dreaded disease and everything, and they're trying to get better. You just think of the mom and the young man, that's an MMA fighter with all the strength in the world, and how many prayers we've said for him and his mom, that somehow he's going to get through this, and how much they believe that really they should try to help people get vaccinated. So many people are doing so many different things. We can do one or two things. We can say, well, I'll tell you what let's do. Let's just go on about our lives and do everything and run the government and everything. We'll see you a week from Thursday and check in, and good luck. Or we can keep trying. Sure, it's tough. Sure, it's frustrating. What's the alternative? The alternative is just to walk away? No, not me. No way. And I can honestly say to the great General Hoyer, to the great Clay Marsh, Dr. Amjad, Secretary Crouch, all the people that are in my office, all the people in this great building, I hope, are really committed in every way to try to urge more and more people to get vaccinated. All the info line on our COVID-19 is up. The free testing, I've told you about, is available. I always want to thank Fruth and Walgreens for what they did, especially early on. It was incredible. We have 85 outbreaks in long-term care facilities, 3 in our church community, and that's Monroe, Raleigh, and Wayne. I commend our church community. They're really trying hard and everything. You can see it in the results. We got 244 inmates with this at 21 facilities and 72 staff cases at 19 facilities. I urge you all the time about giving blood. We're still working with our hospitals. We're going to determine their needs. We're going to be fair and equitable and everything in doing so, and we're going to stand arm in arm with them and reach out and try to help in every way we possibly can. As far as there's another vaccine that's this time of year, it's the time of year to get your flu shot. And just a couple things I want to clean up is the COVID vaccine and the flu shot can be given at the same time. The flu shot is recommended for all those 6 months and older. And so, again, flu shot's really important. Got to get it. Now we got one little announcement to make here that's a gigantic announcement, and it is really an announcement of celebration. Today is the 25th anniversary of Toyota coming to West Virginia. 25 years passed really fast, but now that plant and that great company has grown to employment in West Virginia of over 2,000 West Virginians. It's amazing. We absolutely salute them and we thank them more than you ever know. Remember, the number one thing that I think West Virginians possess that is the most important trait that they could possibly have is their ability to appreciate. You know, they're loving, great people that are really qualified in so many ways, but they appreciate. And Toyota has been a wonderful partner for West Virginia. We only wish them the greatest profitability, the greatest successes. We want them to continue to grow in West Virginia. And absolutely, we thank them from the bottom of our heart. And I want to read one thing to you. This plant is the only plant that Toyota has in North America that makes both engines and transmissions. Now, I want you to get this. They have produced over 20 or nearly 20 million powertrains since 1996. You know, amazing. 20 million cars that you see out there that they have produced the powertrains right here in West Virginia. So listen, again, thanks Toyota, thanks for all you do. Thanks for all the great people at Toyota. Wow, just a fabulous company. Thanks again.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. And as the governor has said, you know, we have an ongoing challenge with the Delta variant of COVID-19, and we have talked for weeks now about the concerns of what the Delta variant might mean, not only for the infection rates in our state, but really for our hospital systems. And today we find our hospital systems very full. We, again, recommend very much for all West Virginians, if you haven't been vaccinated, to choose vaccination and to be extra careful right now. Take extra precaution. And as the governor said, if you develop any symptoms, please get tested. We want to make sure that we are not spreading this illness right now any more than is needed. And we want to try to help people, help us support the hospitals and the hospital systems. The governor has talked about the aggressive ordering and the use of monoclonal antibodies, which we absolutely want to see used to their fullest capacity, because treatment of people at risk with monoclonal antibodies before those people that are infected or exposed get symptoms and have their oxygen levels drop down, reduces hospitalizations by up to 80%. And as the governor said, we applaud the courage of Dr. Walensky and the CDC for extending the indications for booster vaccines. Again, as the governor said, these are really only for people that have received 2 doses of the Pfizer vaccine and received those 2 doses 6 months ago or greater, more than from the second dose. And those of you who have done that, who are 18 and older, generally, I believe, can find a category in which you are eligible to receive a booster dose of Pfizer. And as a reminder, what we've been talking about, the data from Pfizer suggests that after 6 months, 4 to 6 months, the Pfizer vaccine starts to lose some potency from the first series of vaccinations. And after 6 months, more potency. So the manufacturers of Pfizer, along with the real world data that we have seen from Israel, suggests that getting a booster, if you're in that category, reduces your risk of severe infection by 86% if you're over 60 years old. And we know that in Israel that significantly helped their challenge with hospitalizations, which we're seeing today. And we've been very aggressive in pursuing the boosters for our population since we were first in the country to vaccinate our nursing home population, assisted living, and many of our elders. And as the governor said, the list of indications for all West Virginians who are 6 months from their second dose of Pfizer is fairly broad. And they include a number of chronic diseases like cancer, kidney disease, really a variety of lung diseases, dementia or other neurologic disease, diabetes, type 1 or type 2, Down syndrome, heart conditions, HIV infections, liver disease, being overweight. And overweight, as a reminder, if you're a woman, if you're 5'4" tall, it's anything, I believe, over 145 pounds. And if you're a man and you're 5'10" tall, it's anything over about 184 pounds. So overweight and obese qualifies for a booster. Anybody who's pregnant, sickle cell anemia, anybody who's a current or former smoker, anybody who's received a transplant, anybody who's had a stroke or other brain disorders, anybody that has high blood pressure, or anybody that has substance use disorder. So this is a broad list, and we want to really encourage people that are eligible to please go to your pharmacy, to your primary care office, to your provider, or to your local health department, and please get the booster. As the governor said, and what's been out from the CDC is from the Moderna vaccine and the Johnson & Johnson vaccine that we will anticipate that we will soon have information that will allow people that are 6 months after their Moderna or Johnson & Johnson vaccine to get more direction about the potential of boosters for them. And what we are seeing at the hospital level is both predictable and concerning, because we have seen the numbers of fully vaccinated people who are in West Virginia hospitals start to creep up, going from about 13% to about 15% to about 17%, and now around 20% of all West Virginians hospitalized being people that are fully vaccinated. So with vaccine breakthrough cases now becoming more severe, just like we saw in the Israeli data, we know that about 10 to 13 days after the booster dose, we should start to see a great protection. There was an 86% reduction in the severe consequences of COVID-19 in people that got the booster dose versus people that did not in the age group of 60 years old and over. So this is a time that we need to continue to pull together. The governor has said that over and over. And please get your primary and secondary vaccines if you haven't gotten those. And if you're eligible for the booster, please go as soon as you can to get the booster. And that way you'll protect yourself, very importantly, protect our hospitals, but you also protect the good people of West Virginia. Thank you.
Thank you, Dr. Marsh. Next to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good afternoon. Just to highlight a couple of key points that the governor made earlier, just to reinforce. Booster shots are being given as we are on this press conference. A team of folks from our task force and DHHR monitored throughout the night. And I want to thank Dr. Krista Capehart from the Pharmacy Board and WVU who stayed on that throughout the night. And as soon as that notice came through this morning, booster shots were available in West Virginia. We did receive word from the folks that represent the nursing homes in our state that there are booster shots being given in nursing homes now as we are on this press conference. Again, to reinforce what the governor pointed out, nursing homes are getting them, pharmacies, they are available, community clinics, they are available, hospitals, they are available, and some of the primary care providers who have been providing shots to their patients in their offices also have those doses available. If you have an issue with finding a location, please contact the DHHR hotline number, and they can help facilitate you getting to a location that has the Pfizer booster doses available. We have plenty of doses based on the management of our inventory, and we are prepared to manage the inventory for Moderna doses once that is made available for us to provide those boosters. The other thing I'd like to point out and reinforce that the governor's talked about a number of times is the monoclonal antibodies. We, at his direction, have expanded from originally what was 34 hospital locations in the state to now over 100 sites, and that will continue to grow next week. Secretary Crouch has sent a letter requesting additional antibodies for the state of West Virginia, and we are following up with that. So again, if you have an issue as to where that might be available, talk to a provider or call the DHHR hotline, and we will get you to the antibodies if you are in need of the antibodies. Thank you.
Thank you, sir. And finally, to Secretary Bill Crouch with the DHHR.
Hello, everyone. The governor mentioned your vaccine card. If you've lost your vaccine card, you should replace that card. The contact information is on the DHHR website, but you can go where you received your first dose to get a replacement card, or your second dose if there were different locations. But that card should be available to you through those providers. If not, go to the DHHR website. There is information there to fill out a form, which you can quickly do. Once the form is completed and submitted, a replacement card will be mailed to you. So please, if you've lost your card, replace your card. Thank you.
Thank you, Secretary. Dr. Aina Amjad, our state health officer, had a prior engagement. She will rejoin us next week. We'll now go to questions from members of the media. The first question today is from Charles Young with WV News.
Hi, this is Charles Young with WV News. My question is for Dr. Marsh. As you and the governor just mentioned, the floodgates for the boosters are now open. Most people over the age of 18 could look down the list and find a reason to go get the booster shot. Is there any medical reason why a person under 65 who's healthy, who doesn't have any medical conditions, why they shouldn't receive this? Is it going to be harmful to get it, is what I'm asking.
Dr. Marsh, please go.
Thank you, Governor. Thank you, Charles. So the list of indications that I read off of the CDC's release were really indications that were vetted through the Centers for Disease Control and their advisory group. So, when you look at the severe consequences of COVID-19, Charles, we would have said early in the pandemic that children and younger adults really were spared some of the more severe consequences of COVID-19. And while that's still generally true versus people that are over 60 or 70 or 80, we know that the Delta variant has been much less forgiving for all of us. So we would very much recommend for people who do qualify for those criteria that they do consider getting boosted. The reason why the Advisory Committee for Immunization Practices and the Centers for Disease Control did not reduce that age down to 12, between 12 and 18, because there are questions about risk-benefit issues given the relatively infrequent and rare complication of having inflammation in the heart related to the mRNA vaccines. But that's the reason why they did not include that age group. But we would heavily recommend that people consider being revaccinated based on what we know as a loss of potency of the Pfizer vaccine 6 weeks after the vaccine. So what we would really want to make 6 months, I'm blocking anyway. What we would recommend for people to do would be to also folks that are in frontline worker conditions that would be susceptible or exposed to a lot of people would also who got Pfizer vaccine 6 months ago or more should also consider that. Thank you.
Let me just make this thing super simple. Now, you know me well enough to know that I speak really blunt to you, and I speak absolutely because in just terms that all of us can get easy. Dr. Marsh said to us just a few minutes ago that anyone age 18 and above that is 6 months out from when they got their second dose of Pfizer, I want to make sure everybody totally understands, if you got Moderna or you got J&J, don't go to the pharmacy and try to get your booster vaccine. It's not for those that had Moderna or had J&J yet. We'll let you know, and we'll let you know very soon. But in that being really blunt again and everything, I want you to understand this. There's a whole list of things. Dr. Marsh just said a second ago, if you're 18 and above, you'll qualify in some form to get your booster shot if you'll just go. I would say to you, and I'll make it so simple, is if you have gotten your vaccines and you've not grown antlers from the very get-go, now you're eligible to take the booster shot. Now, there's all kinds of categories. There's diabetes and heart conditions and dementia and everything in the world. But really, you will qualify if you want to get that booster. We would highly recommend that you get that if you're 6 months out. We would highly recommend that you go get that and everything. You have already made a decision in your life to get vaccinated. You already made that decision. And now Dr. Marsh is telling you all of the research is saying that if you got Pfizer and you're out close to 6 months, we're seeing a drop-off in the effectiveness of Pfizer out in the 6 months time period. Beyond 6 months, we see a significant drop-off. And by seeing that significant drop-off, you need a booster shot. We've said it over and over and over, and you will qualify. You will qualify. Just go and get your booster shot, and you will help us stop this surge at the hospitals as well. You know, you've already made the decision to get vaccinated. You will qualify. You will qualify. Go and get that booster shot. And it'll help us at our hospitals and help us a lot of different places and may very well save your life. So anyway, thank you so much.
All right, thank you, Charles. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. I want to drill down into that 20% vaccinated, hospitalized number a little bit. Are we seeing that they are the same people that would be at the far end of that window where they would be more, where the efficacy of the vaccine may be dropping off? Have we drilled down that far to confirm that is one of the problems? The other question would be for General Hoyer, and that is, as you're going around to the nursing homes, was there a choice for the people in the nursing homes on what vaccine they were going to get? Or did you have like nursing home A get Pfizer vaccine almost unanimously? And does that throw any logistical problems in getting the vaccine out to those nursing homes? Thank you.
Well, Paul, let me touch on this. I'm sure that overwhelmingly they were Pfizer because remember we got to the nursing homes right out of the gate, and we didn't have Moderna when we came right out of the gate. But anyway, you know, I think Clay is is to answer the first part, and then from that, General Hoyer jump in.
Thank you, Governor, and thank you, Paul. So we do know that average age, median age nationally of people who are in hospitals who have vaccine breakthrough cases are around 80 years old with other medical problems. We also know in West Virginia that we have seen more vaccine breakthrough cases in nursing home outbreaks than we have in other settings. And we also know that people in the hospital who have vaccine breakthrough cases are older folks with other medical problems. We have not been able to delineate what source of vaccine. Did they get Moderna or did they get Pfizer? Although we're looking at that. But we are seeing that loss of potency that we reported from Israel and that Pfizer has reported. And that's the reason why we're so happy to have these boosters available today.
And Paul, I'll cover the second piece. So actually, we do have a lot of Moderna in the nursing home because of the rural nature. And if you remember in the beginning, the Pfizer had to be under a much different temperature control than the Moderna. So our nursing homes had requested us to provide a significant amount of Moderna because it was easier for them and the pharmacies that we were working with to manage. But you also have a case where we're a number of months, almost a year into when we did our first vaccines in nursing homes. We've had a number of nursing home residents turnover, nursing home residents who may have been in the hospital, got a Pfizer dose, came in to a nursing home, or vice versa, Moderna dose into that. So it is a lot of logistics work on behalf of the nursing homes and our team to make sure we get the right number of doses in the right places. And I'm proud of the fact, and I know the governor is too, that at about 6 o'clock this morning, they were already executing and already had in place who needed what doses and where they were to go. Thank you.
All right, thank you, Paul. Next, we'll go to Dave Mistich with West Virginia Public Broadcasting.
Hi, Governor. Hi, panel. My question is about, football games, other gatherings, and such. You guys expressed confidence, earlier this week, I should say, over the past couple of days, that this latest peak that we believe that we've already peaked and that we're coming down on the other side of it. I'm curious with all these activities in large crowds, 50, 60,000 people, and I'm not just talking WVU, but Marshall high school football games all over the state. Do we have any concern that these large gatherings are going to lead to another spike back up?
Well, David, let me just throw this out. We think from the standpoint, here's what you got to weigh out. First of all, we're outside, and that helps tremendously. From the standpoint of trying to maintain some level of normalcy, and we're outside, we still feel like we're okay there. Are we concerned? Well, of course we're concerned. We hope and pray we're close to a surge peak here with this terrible Delta variant. But at the same time, there's not going to be a day that goes by, no matter what the circumstances may be, that people here aren't concerned, and me included.
Thank you, Dave. Next, we'll go to David Beard with the Dominion Post.
Hi. Regarding the booster, I kind of remember, and I don't remember the exact number of days, it was like 10 days to 2 weeks that you're after your second dose of Pfizer that it was considered fully effective. About how long after your booster will that be effective? Does it take that long to fully kick in? And how fluid is that 6-month benchmark? Like if you're going to be going someplace where you're going to be exposed and you're a week from your 6-month anniversary, can you get it a week early? Do you have to wait till that exact day? How is that going to play out? Thanks.
Dr. Marsh, I think it's got to be you.
Yeah, thank you, Governor. David, I think that, as you go forward and you start to look at the data from Israel, which is the real world data that we follow, then we see that in people that were over 60 years old who received their booster dose of Pfizer, it took them about 10 to 13 days to see a substantial reduction in severe cases related to vaccine breakthrough. And so we would say probably about 10 days would be the target that we would search for. We had talked about 14 days being the target after the second dose. And related to the fluidity of the timing, I think generally if folks are, around that 6-month period of time, and particularly if there's going to be, an exposure that you're concerned about and you do qualify, then I would anticipate that pharmacies and pharmacists or primary care clinics or other places where you get the vaccine would be willing to go ahead and give that booster shot to you in that setting. As CDC and FDA approved it, though, it's 6 months from the second vaccine of Pfizer, and so that would be the EUA indication that has gone for.
All right, thank you, David. Next to Jess Mancini with Ogden Newspapers.
Hi, thank you for taking my question. We're coming up to about a year since the vaccines were available, and could you have imagined a year ago that there would have been so much opposition and reluctance to taking the vaccine, something that could save your life, and all this misinformation concerning the vaccines? Plus, do you expect any reluctance from people on taking the booster shot?
Well, Jess, let's, first of all, let me take this question. I would say first and foremost, West Virginians have stepped up and stepped up in a good way. And we don't want to cast any stones in any way. We want to be totally respectful, as I've been through this whole thing, about people's choice as to what they should do. I've urged in every way, and so much of, if you'll go back to just what I said the other day in regard to the Johns Hopkins doc, what did he say? The first thing he led off by saying is, social media has really, really, really hurt us here. There's so much misinformation that's out there. It scared people. He said, what is the first response when you become really anxious? What is your easiest response? It's no. And so with all that, we've got a real challenge to be able to educate, people in a better way to know of the safety of this and how important it is for their neighbors and looking out for one another and all that, what West Virginians do all the time. I love our people way beyond good sense. And really, at the end of the day, I truly believe that, if you were to say to me, are you shocked? Probably not. There's times when West Virginians can be stubborn, and there's times when we can get things in our minds that maybe in the best things. But do you feel really down on that and everything? No, I don't. No, I don't. I'm still immensely proud of our people and everything. We could have lost so many people in West Virginia. West Virginia could have been a bloodbath beyond belief. When you think of all the sickness that we have in West Virginia and the chronic illnesses and all the and how the state is the third oldest in the country and everything, and located right within a rock's throw of 2/3 of the population of the country, it could have been a total bloodbath. But with all that, we've kept our people safe, and we've done an amazing job in doing so. But we could have never done that without the people, and so I'm really proud of them. And I hope to goodness that more and more will get vaccinated, and that we'll get through this reluctancy and get a lot of people to the finish line. But anyway, that's my feelings anyway, Jess.
All right, thank you, Jess. Governor, I'll turn it back to you.
Okay, I've told you all along, I represent the truth. I don't represent, I'm your governor. I'm the governor of all West Virginians, not just the Republicans, not just the Democrats, not just the independents. I am not the old, not just the young. I'm the governor of all of you, and I mean it when I tell you that I love you all. You know, I've told you over and over that I represent the truth, and that's what I'm going to do all the time. General Hoyer cleaned up a mistake that I made earlier today, and I love it. You know, it's just a natural tendency for me to believe, well, you know, the nursing homes, right out of the box, you know, we were all over them as far as giving them their vaccines, and we didn't even have, you know, Moderna in the very beginning, but it took a little while to get really out of the blocks. You know, while the rest of the nation was still stumbling around all over themselves, we did have Moderna and everything. And so I appreciate him cleaning that up. And you'll find in our group of people here, no one has ever told anything but speak the truth. Speak the truth. No matter what anybody says, we're all transparent. We speak the truth. You know, I would tell you this too. I would go back on Dr. Marsh, you know, of how great a man he is and everything in every way. Can you remember when we had 3 Delta variant cases in the state? We had 3. And then through a matter of time, it almost took forever, we got 12. And then shortly after that, Dr. Marsh said, it's getting ready to go in West Virginia. And we absolutely were looking outside and the sun's shining. You know, Wendy's was still open. I mean, absolutely, we didn't even think, well, gosh, there's not anything to worry about in a big way right yet. Dr. Marsh said, it's getting ready to go. And look where we are today. Today, I just read 56 more great West Virginians have died. 56 people. I mean, do you realize that is just like, you know, a lot of the airline flights now are 50 passenger planes, the nice jets. That's like one of them just going right down. And we just go on like it's nothing. Well, it isn't nothing. It's a lot. And it's really, really important. And, you know, and I ask you over and over to not let these people become a number. We've lost a lot right here. We lost a 23-year-old, I think. I think that was the last person, or one of the last people that we read from Logan, 28-year-old. You know, we lost all kinds more of our wisdom. You know, we can stop this. We can stop it by getting out and getting absolutely vaccinated. Just one other thing that, you know, that you said is, are we going to see the reluctancy in the booster shots? I don't think so. The reason I don't think so is those people have already made a decision in their life. They've already decided, I'm going to get vaccinated. And by absolutely making that decision, I think those people will really come. You know, but the only other thing I'd add is just this. Is remember Dr. Marsh saying, this is coming, and we moved, but we didn't really move to the magnitude of what I think we should. And literally, 3,700 vaccinated since Wednesday. Great, but it's not as good as what we should be. And we're trying with all in us here, and we're trying any and everything we possibly can to get more people to the finish line. Any gimmick, any marketing plan, anything we can. And I absolutely ask you as West Virginians to help us, to help me get more and more and more of our folks vaccinated. Push them and urge them in every way you possibly can, because with that, we can stop this. Reading 56 names is not fun, but it is a heck of a lot worse for those people, those families. Absolutely love them and embrace them and help me get us there. You know, without question in any way, go get the booster shot. Go get the booster shot now. Thank you so much.